now, Sophia Wanuna, would like to take it to the next level and discuss prostate cancer.
Indeed, prostate cancer is what we're discussing now, one that is exclusively, unfortunately, affects men. And so we want to talk to Dr. Mburugu this morning. Is joining us in studio. And remember, we'll have our phone lines open as well for you. You can call in if you have a question or a comment you'd like to engage with the doctor this morning on this subject. Do call in. Dr. Gitobu Mburugu is consultant, urologist, Kenya National and Aga Khan University Hospitals as well. Thank you for joining us.
Thank you for having me
this morning, and a very good morning to you.
Good morning to you too.
We're talking about prostate cancer. What is prostate cancer? What is this cancer about? Okay,
the prostate is a gland found exclusively in men. The work of the prostate is to capacitate sperm. When a man's testes produce sperm, the secretions from the prostate help them be capacitated or more active as they go to cause conception, if that be the case.
Okay.
So the prostate is a small gland the size of probably that size that sits between the urethra and the bladder in men. And the only way you can feel the prostate in a man is through the back passage, by putting your finger into the rectum of the patient. So as you grow older, as a man grows older, two things can happen to the prostate. It starts growing and can cause urinary problems. And this is called benign enlargement of the prostate. Or if you are unfortunate to be one of the 1 in 8 men who will then proceed to get prostate cancer, that can happen. And how do you know that your prostate is growing or is probably getting cancerous? In the earlier stages, the two are not distinguishable. Benign enlargement and cancer in the early stages present almost the same. So men will complain of what we call lower urinary tract symptoms, whereby they may find they're going to pass urine a bit more frequently, or they cannot hold urine like they used to hold before, or the stream is becoming a bit weaker. You cannot hit the wall like you used to do when you were younger, or you're waking up at night too many times, or any of that combination.
Okay, so what causes it? At least we through that have been able to outline for us why at least it's only in men, because this is only found in men. What causes it?
Well, the jury is still out there.
Yeah.
One thing that we know is a definite cause is age. As you grow older, you will, if you live to be 80 or 90, chances are that you'll have prostate cancer, which will either be active, you'll know about it, or you may not know about it. They have done studies where they have looked at the prostates of men who have died in their 80s and 90s for various other causes, and most of them have prostate cancer, but they didn't know about it. So age is the most common contributory cause. Other things have been said but not proven. It was noted people from the Far East, when they migrated to America, in the Far East they have very low rates of prostate cancer. When they migrate to America, within a generation or two, they have caught up with the Native Americans. And it was thought probably it's having a change of diet, eating too much animal protein, meat so to speak, because in the East they eat more soya products and vegetarian diet. Right. So meat and meat products have been implicated. Infections is another theory out there. If you've had a lot of sexually transmitted infections in your young age, chances are that you may get prostate cancer. This is not proven. Okay. Smoking, the usual culprit, is also implicated. Black race, we know if you're a black man, you're at a higher risk of getting prostate cancer and worse prostate cancer than a white person.
Really?
Yeah.
Because I thought the numbers were more prevalent in America. I was looking at some of the studies that have been done there, because we don't have the figures yet in Kenya. How do they compare?
If the reason why the Americans seem to have more of it is because they have done the studies, they have the statistics. Unfortunately, in Africa, we don't have statistics. But we know in America, if you look comparatively, blacks have more rates of prostate cancer than whites. And if you look at Jamaica, the rates are crazy. And it is the cancer in the black population is more aggressive than in the white population. Okay. So, and I think a study from Nigeria also showed that the prevalence there is a lot more than we have thought. So it's a matter of us not having the statistics rather than us not having the cancer.
Okay. So we're talking about the risk factors. You mentioned quite a few of them since the cause is not known. But from smoking, the age, what else do we know for sure? And your interaction, do many people come when it's too late? Is it curable?
Okay. Traditionally, most people in our country came late when the symptoms started. Like we said, most cancers, as we know, as a rule of thumb, most cancers, by the time you're getting symptomatic, the disease is either locally or widespread. It's either locally advanced or widespread. So traditionally, most men would come late. But as time has gone on and we have gotten more modern means of diagnosis and screening and so forth, we're finding more and more men coming in at a relatively early stage when it's still curable. So probably people going for insurance, testing for insurance purposes, for mortgages, or men attending well-men clinics, getting screened, having an examination and a blood test to screen them, and being found with cancer coming relatively earlier than before. But by and large, most men are still coming late.
They're still coming late.
Yeah.
And for those who come, what are those, you mentioned frequent going to the urination?
Yeah, the earlier symptoms include what is known as lower urinary tract symptoms. So going to the toilet more frequently, feeling you may not be able to hold, your stream becoming a bit weaker, getting up at night many times. Sometimes when you start to pass urine, you feel it's a bit blocked, and then after some time it comes. So all these are early symptoms of either enlargement or cancer. In the early stages, it is not distinguishable whether it's enlargement or cancer. But as it progresses, then you might find you become impotent, as we say, because the cancer might spread to the nerves that cause you to be potent. So your erections, you may start losing your erections. You may notice that you're passing blood in semen. When you ejaculate, you may notice as it now starts progressing a bit further, going to other organs, the favorite port of call being the spine. So you may find people will present with low back pain. So all these are ways it can present.
Okay, so it has quite a diverse repercussions as it goes on, progresses. But something you've mentioned, that it becomes difficult to distinguish it at early stages. You could think it's something different.
Yeah, you could think it's just benign enlargement of the prostate. Really?
So then what does one have to do so that it doesn't continue growing and perhaps it's a prostate?
Yeah, so if you have these symptoms, the ones that we've talked about, it is prudent that you see your doctor, who will do one of two things. He will take a blood test known as a PSA. PSA is prostatic specific antigen, which is used as a measure of suspicion of prostate cancer. So if your PSA is a bit elevated for your age, then that's a risk that you may have prostate cancer. The other thing we do is examine your prostate from the back passage, and a lot of men find this uncomfortable and a bit embarrassing, and it's been postulated this is what causes a lot of men to fear coming for checkups. But what we do is we counsel the patient beforehand. We tell him what you're about to do. We ask him to relax, and if done in a patient who is well counseled and well relaxed, should be painless.
Okay.
So if then the prostate's supposed to feel smooth, and if you feel any nodularity or any roughness on the prostate, or if your PSA is elevated, then we may elect to do a biopsy. A biopsy is whereby they take about 12 small pieces of your prostate, again through the back passage using a special needle, and this is submitted to the pathologist, who then looks at it and tells us, do you have cancer or not? Okay,
we'll continue with that in a short while. We have a caller online. Josephat, good morning.
Good morning.
Thank you very much for calling in. What's your question?
Yeah.
Sorry? Josephat? Josephat, can you hear me? Hello? All right. I think you're still trying to get to us. We can't hear you, but do call again. I would love to get your question this morning. But Dr. you were saying that for most men, what is most uncomfortable is the manner in which it is checked. Men don't want that. They're very uncomfortable. Is it pain? It must be painful.
If done badly, it's painful.
What do you mean you say badly?
The patient has to be told what is going to be done to him.
Okay.
And more importantly, he has to relax. And the doctor has to be gentle. So if you rush it, if the patient is apprehensive and he's clenched his sphincter, the muscle that controls the back passage, or you're too rough in your examination, then it's a bit painful. Okay. That's why telling the patient what you're going to do and having him well prepared in the right position and with generous lubrication, it should be painless.
It should be painless. Yeah. So for what you've been able to see in Kenya, what are some of misconceptions, some of the trouble areas as a doctor treating this you've been able to notice and perhaps needs information and clarification?
Yeah, there are lots of myths out there. A lot of my patients will tell me, first of all, they don't like coming to the hospital. They have to be convinced that they need to come to the hospital.
Yeah.
And once they're in the hospital, then they will be a bit apprehensive about you examining them, but once you get over that, then you tell them probably you suspect they have prostate cancer, then they start saying, oh, I heard that if you puncture my prostate, because that's what we do to take the biopsies, then it will cause the cancer to spread. That's a very common misconception. Okay. Prostate cancer is a very slow-growing cancer, and therefore whether you puncture it or not, it doesn't affect its rate of spread. And the other things we hear is people do not know exactly where the prostate is, so you have to explain that. Men think that if you probably do the prostate exam, they may become incontinent, or they think they're being violated. So all these are the things that probably inhibit people from coming forward.
But as you said, it's curable.
In the early stages, if you catch it when it is still within the prostate, before it has gone far beyond the prostate, or if it is just slightly beyond the prostate, then it is curable. Currently in Kenya, we have 2 ways of curing this. You can do radical surgery, which is known as radical prostatectomy, where you remove the whole of the prostate and the glands around it called the seminal vesicles. And this is a major operation taking about 3 to 4 hours, and thereafter, you have to have a catheter for about 2 to 3 weeks. A catheter is a tube going into the bladder to allow that area where you've operated to heal. The other way you can cure cancer of the prostate, if it is early, is by radiotherapy. Radiotherapy means you're using X-ray waves or rays to burn, so to speak, to burn the prostate cancer. This is done in about 7 weeks. You have to attend the session every day, Monday to Friday, for about 7 weeks.
Okay, let's take this call as we continue with that understanding of the treatment options. Moses, good morning.
Hi, Sophia. How are you?
I'm great. Thanks for calling.
Morning, Dr. Lee.
Morning.
Yeah, I have a concern. One of my prostates sometimes enlarges, then after some time, then it disappears. So I just wanted to ask, are these some of the symptoms of the cancer, or is just a normal occurrence in men?
Okay, thank you for your question, Moses. I think what you meant probably is one of your testes, not the prostate. The prostate is inside the body, you don't see it, and you wouldn't tell if it's swollen or not. So I think what you're talking about is your testes. The fact that it comes and goes probably means it's nothing very serious, but it could be one of several things. It could be what is known as a hernia, where you have your intestines coming out through a small hole into your scrotum. Or it could be what is known as a hydrocele, which is fluid accumulating around the testicle. Or it could be that you're getting recurrent infections of the testes if it is painful. So you need to see a doctor to make a correct diagnosis, and he'll advise you further.
All right, and thank you, Moses, for calling in. So back to the treatment, talking about 7 weeks every day.
Yeah, that's for radiotherapy.
That's for radiotherapy. And is it assured that after those 7 weeks, for sure, if you attend, 5 days a week, you're good?
Now, unfortunately, in medicine, there's no 100% guarantees, but there's about a 90% chance that you'll be cured. If it is within the prostate, the chances are higher.
But that also is very expensive, doctor.
It is expensive, number one. Number two, these machines are only found in Nairobi. We have an older model in Kenyatta, and we have newer models in the private hospitals, of course, which are more expensive. The Kenyatta one, of course, is there's a lot of patients there, as you'd understand, waiting to have that done. So we need probably to devolve this service to the counties, because surgery is expensive as well, and not many people can do it. In the whole of Kenya, we have 32 urologists. Not all of them do radical prostatectomy. We have just 32 urologists. Million. Exactly. Yeah. So, and considering that about 1 in 8 men will get prostate cancer, you can see we can't deal with it surgically. And there's realistically no way, as of now, there's no realistic way of preventing. Like, you can prevent cervix cancer, but you cannot prevent prostate cancer. Okay. Because there's a vaccine for cervical cancer. So we probably will need to devolve this radiotherapy services out to the counties.
To the counties.
The machines are very expensive. The doctors who run them are very specialized and highly trained doctors. So it's a long way. We are a long way.
Yeah, we're a long way away. When you say 1 to 8 men, you did mention 1 to 8 men will have prostate cancer
in their lifetime. Yes.
In their lifetime, and then it's hard to detect.
Yes.
And then this, why is it? I'm thinking in the day and age where technologically savvy, studies and research continue, what has made it so hard to be able to have a clarity that, when a man goes for this checkup, they'll very quickly be able to identify it?
You remember when you talk about technologically savvy and all this, we're talking mainly about Nairobi.
Yeah.
If you go out to the districts, we may not be that technologically savvy and we may not have all the information. But yes, you're right.
But even in the world over,
nothing much has changed. Nothing much has changed in prostate cancer, really.
Okay.
We have lots of new treatments and research, but these are for advanced disease and they do not add much to your life. If these treatments probably add a few months to your life, that's for advanced disease. So you're right, nothing much really has changed, despite the fact that it affects men, and these are men in past their 40s, so these are probably men in power. So it has all the political support, but yet we haven't advanced much.
Okay, let's talk to Michael. Good morning, Michael.
Hi, how are you, Sophia?
Hi, thanks for calling.
Yeah.
Go ahead with your question.
No, I just want to ask the doc a simple question. Although it's been asked so many times, I want him to tell the young men out there, is it true what they say that if you're not active sexually, it could lead to, cancer of, the topic today is prostate cancer. And is it true that if you're a smoker, you have to, at some point, you'll have to,
If what?
If you're a smoker.
If you're a smoker,
Cigara. Yeah, utavuta cigara. Is it a must that at some point you'll end up, getting cancer? Those are 2 questions, Okay.
All right. Thank you, Michael.
Thanks a lot.
Thank you, Michael, for your question. The first one, like you said, yes, it's always asked because we try to associate everything with sex and politics. So there was one small study done in the UK where they found men who had a lot of sex when they were young and therefore presumably was high-risk sex. Everything young people do is normally high-risk.
High-risk, yes.
So this were found to have more cancer when they grew older.
So the ones who were very sexually active when
they were young.
Okay.
Whereas those who were more sexually active when they were older had less prostate cancer. So it was not a big enough study to make concrete conclusions. But like we said when we were talking about the causes,
right.
Repeated infections, sexually transmitted or urinary infections might be one of the theories of causation of prostate cancer. So young men out there, please don't have a lot of unprotected sex. Actually do the opposite, have very little sex, unless you're married, of course, and unless you're using protection.
Right.
So the question of smoking, we know smoking is associated with various cancers, starting from the usual one, lung, to kidney, to bladder, to whatever cancer you look at is associated with breast in ladies, is associated with smoking. So if you're smoking, I always tell people smoking has everything against it for you.
Right.
It's expensive, it causes cancer, makes you smell bad, makes you lose your appetite, makes your teeth look bad, makes you look older. So probably stop smoking if you can. Yeah.
All right. Thank you, Michael. For that question, we have Abel asking, does masturbation cause prostate cancer?
No, it doesn't. Masturbation does not cause prostate cancer.
Okay.
Yeah.
All right. Another question here. He feels pain in his groins. Could it be the symptom of prostate cancer?
It depends on how old he is. If you're less than 45, you probably don't have much to worry about. Prostate cancer starts affecting men who are older than 45. Pain in the groin could be very, very many things. It could be an infection, it could be an inflammation of the prostate, it could be an infection of the urinary tract. So pain in the groin is not necessarily equals to cancer. So have a doctor look at it and probably run a few tests to see what is causing the pain.
All right, and we have another call. Njoroge is calling in. Good morning. Good morning, Njoroge.
Good morning to you. Can you hear me?
Yes, I can hear you. Thanks for calling.
Okay, thank you so much. And thank you to the doctor for enlightening us.
Yes.
Yeah, I have a question. I would like to know any other male characteristics the prostate gland controls. I also would like to know at what age the gland can be removed. You know, other adverse effects on the part of the human being, the gland. Let's say, surely you are 70 years, and you really don't intend to marry another wife. You don't need reproduction. Can it be removed, even mainly to prevent occurrence of cancer?
All right.
The other one is what causes the enlargement of the gland? Is it maybe hyperactive, sexually hyperactive men, or below par, for that matter? And is it genetically, are you genetically predisposed? If your relatives had that disease, are you likely to get it?
All right.
Thank you so much.
Thank you so much, Njoroge, for the questions. Daktari, I hope you're...
Yeah. Thank you. So the prostate gland, like we said, its main function is to capacitate your sperm. It produces chemicals that make the sperm able to function once they're inside your partner. It does not have any other function other than to cause trouble as you grow older. So when you, like we said, as you grow older, two things can happen. The prostate starts enlarging, but when it enlarges, it doesn't necessarily cause symptoms. In some people, it will cause symptoms. Some people, it will not. If it causes symptoms, then this can be treated medically. We can give you tablets to one group of tablets can shrink your prostate, and the other group of tablets can control the symptoms. However, if it grows and then causes complications such as kidney failure or bleeding, or you go into retention of urine and need a catheter, then we do what is known as simple prostatectomy, removing the prostate for enlargement, not for cancer. And this is a very common operation done all over by surgeons who are not even urologists in Kenya. If then it's, on the other hand, you have cancer of the prostate and it is not spread, then you need the major operation you've talked about, or radiotherapy, which is a major operation. Now, we do not remove the prostate to prevent problems. It has to have a problem for us to remove it, because there are consequences. One of the consequences of the surgery is you're not able to hold your urine very well, especially the first 1 or 2 weeks, but thereafter it improves. And the other one is you lose your potency, either permanently or temporarily. So we do not...
because he was talking about him, if you're not worried about the potency issue, if it's still...
It's still, I don't still think it will be ethical to remove it if it's not causing problems, because we know surgery sometimes goes wrong, so you don't want to put yourself unnecessarily at that risk.
Genetics?
Genetics. About 5 to 10% of prostate cancers, if you look at all men with prostate cancer, about 5% of them are genetic, meaning they run in families. How do we know that you're at a risk of being, of having cancer if your family has it? Is if your male relatives, first or second degree, so either your brothers or father or paternal uncles have had this cancer at the age of less than 50 then there's a small chance that it runs in the family.
Okay.
So if you get prostate cancer and you're less than 50, then we advise you to have your relatives
Also
who are younger than you
screened.
get screened when they get to 40 or 45.
Okay.
Yes.
Thank you, sir. Sir Njoroge is one who calls. And we have Salim as well on phone. Salim, good morning.
Good morning, Sophie.
I'm great. Thanks for calling. You have a question?
Yes, I have a question for Dr.
Go ahead.
First, I'm very grateful to get this information. And I'm thankful to the doctor. I have actually gone through that, and I can understand what it means about going through the testing. I'm glad I was checked and I was found without one. But I'd like to ask the doctor, how often should one actually subject himself to checking whether one has prostate or not? How often can one do it just to be on the safe side? One. Two, this clip is very important. If I wanted to have a little bit, how can I actually want it? Can you give me a link and how I can get it so that I can watch it over and over again? But I'm very grateful. Thank you very much.
Wait, Salim, before you go, if you don't mind repeating the second question.
I said I just wanted to know how can I see the same clip again, because it's something which is very refreshing. One can go through and be able to see, update himself.
See the same clip.
Okay, all right. Thank you. Oh yeah, thank you, Salim. Got you. So the first question on after he's been the first screening, how often?
Okay, so if you've had your first screening, preferably at about 45, then there are many schools of thought, but I would say probably once every year or at most once every 2 years. And it always has to be the blood test and the physical examination, the rectal examination. Just remember the previous caller had asked about sex again and prostate cancer.
Yes.
Like we said, there's no real correlation whether you have sex or not. It does not put you at risk for prostate cancer. What puts you at risk for prostate cancer is if you have sexually transmitted infections. This is not completely proven, but there's a high correlation between people who have had many infections and who get cancer later. But this is not to stigmatize the cancer and say those who have cancer have had STIs. No, it's not that way.
Okay.
So just to answer what you said.
All right. We have one more caller. Josephat, good morning.
Hello, Sophia.
Hi, how are you?
Can you hear me?
Yes, I can. Thanks for calling. Go ahead with your question.
Yeah, there are so many allegations concerning the size of the private of men.
Right.
I don't know whether it is right to do it has something to do with the prostate cancer.
Sorry, would you come again?
I'm talking about the size of men's private parts.
Okay.
That it have anything to do with the prostate cancer.
Okay, men's.
Because many times you may find that somebody is just around 70 to 80 kilograms in weight, but you find that he's complaining of having some small testicles, small pellet. I don't know whether it has something to do with the prostate cancer.
All right.
Okay.
Thanks, Josephat.
Just for the size of men's appendages does not have anything to do with prostate cancer. Having small testes is not a risk, or having big testes is not a risk. And similarly, if your phallus is big or small, it doesn't have anything to do with prostate cancer. But we do know that if you do have prostate cancer, as it spreads, it may make you impotent, and that it spreads to the nerves that cause you to have erections. So probably the potency is relevant, but not the size of the organs.
Okay. Finally, is there a way to avoid prostate cancer? Somebody asks.
There are many ways that are being postulated, none of them very proven. So leading a healthy lifestyle. Okay. So avoiding smoking, avoiding getting recurrent infections, moderating your meat intake, more vegetarian diet. It is said that lycopenes, which are chemicals found in tomatoes, cooked tomatoes especially, are protective, not proven yet. Avoiding smoking we've talked about.
Yeah.
And then recently there has been there have been research that says the tablets that we use for shrinking the prostate in benign enlargement of the prostate can also protect you from having prostate cancer.
Okay.
But they have not been, this has not been taken up actively by the world. So this is a discussion between you and your doctor. If probably you're at risk, maybe you have a family history, probably I would go for that. But this has not been taken up actively by the world. Yeah.
All right. Thank you so much, Dr. Gitobu Mburugu, for joining us this morning. He's a consultant urologist, Kenya National and Aga Khan University hospitals. And what an insightful conversation. Lots of feedback on that. And Salim had actually also asked where you can find this interview. It will be on our websites and Morning Express. On the interviews, it will be there, so you can be able to rewatch and just catch up what Doctor was talking about earlier on, in case you were not with us from the beginning.